Hello viewers, in the previous video I had talked about anatomy of esophagus. So logically speaking, now I need to talk about the physiology of esophagus. Basically, what role does the esophagus play in the human body? Esophagus plays a very important role in swallowing, what we have deliberately made more difficult to understand by giving it a more difficult name called deglutition. Deglutition is basically medicalese for swallowing. So we will understand what is the physiology of deglutition. Esophagus is by no means the only structure that helps in deglutition, but it does play a very important role. So without further ado, let's understand the physiology of deglutition, or in simple words, how does swallowing happen in the human body? So deglutition has three phases. Oral phase, which is also known as buccal phase, buccal meaning the inner aspect of the cheeks. Oral phase or buccal phase followed by the pharyngeal phase, and then we have the esophageal phase. So we will talk about them one by one. Let's start with the oral or buccal phase. This happens when food is placed in the mouth. This can be solid food, can be liquid food. But when the food is placed in the mouth, if it is solid, it is chewed with the help of our teeth, which is called mastication. Again, every normal English word, when placed in context of human physiology, has a very difficult alternative word also. So food is placed in the mouth and chewing happens or mastication happens, then it gets lubricated. The food gets lubricated with saliva, is converted into a bolus, and is propelled backwards into the pharynx. So the oral cavity ends at the anterior two-thirds of the tongue. Beyond that starts the oropharynx. And this propulsion of the food backwards into the oropharynx happens by elevation of the tongue against palate. Oral phase was voluntary, pharyngeal phase and esophageal phases are involuntary, that is, they are happening on their own, not under the control of the human being. So pharyngeal phase starts when food comes into contact with pharyngeal mucosa. A series of reflex actions, that is, actions that happen on their own, start. These reflex actions send food to the esophagus. The objective is twofold. Food should reach the esophagus and food should not reach anywhere else. So that's the role of the reflex actions. What are the reflex actions? First, there is closure of the nasopharynx. How does this happen? Soft palate contracts against the passivans ridge. What is passivans ridge? We will make a different video for that. Closure of oropharyngeal isthmus prevents food from going back into the oral cavity. This happens by contraction of tongue against palate and sphincteric action of palatoglossus muscle. And there is closure of larynx, which is very important because if food goes into the larynx, it can lead to aspiration and even death potentially. Contraction of pharyngeal muscles and relaxation of cricopharyngeus simultaneously or in a synchronous manner helps in executing all of these tasks smoothly. Now we will briefly describe how prevention of aspiration is taking place during swallowing, because imagine food is entering the pharynx and pharynx is the path for both air and food. So it's like a big road which is bifurcating, and you want the food to go into the food pipe and the air to go into the windpipe. You don't want, in any case, you don't want food to go into the windpipe. So it's very important to prevent aspiration, that is, the food should not enter the larynx or any part of the airway for that matter. So the best way to do that is temporary cessation of respiration. So if you have noticed, you probably haven't, when you are swallowing, respiration ceases for that minute moment in time. So that's step one. There is temporary cessation of respiration during swallowing. Step two is laryngeal inlet closes by contraction of aryepiglottic fold, closure of true and false vocal cords, and elevation of larynx under the base of the tongue. A common misconception is all of this is done by the epiglottis. That is not correct. The role of epiglottis, in fact, is not even clear. There are patients who have had their epiglottis removed surgically due to cancer treatment and they still don't have any problem with aspiration. But it is true that epiglottis does deflect back when food passes into piriform fossae. However, what is the importance of this deflection? Nobody really knows for certain. So what we have learned in school about the single most important role played by the epiglottis to prevent food from entering the windpipe is not entirely accurate. overhyped at best. Now we'll talk about the esophageal phase, which is also an involuntary phase. This starts when the food enters the esophagus. Surprise, surprise. Moment food enters the esophagus, the cricopharyngeal sphincter closes. That is the upper esophageal sphincter. Esophageal peristalsis starts and the gastroesophageal sphincter relaxes. The gastroesophageal sphincter must relax much earlier than the food reaching the lower end of the esophagus. It should not happen. Food should not go there and nudge the esophageal sphincter at the lower end to relax. That will create a problem. So when the peristaltic waves reach the lower esophageal sphincter or the gastroesophageal sphincter, it relaxes automatically much before the food reaches it, allowing for smooth passage of the food from the esophagus into the stomach. Once the food has reached the stomach, gastroesophageal sphincter closes, thereby preventing reflux of food from the stomach to the esophagus, which is known as gastroesophageal reflux, that is prevented by the closure of the gastroesophageal sphincter. So in many cases, when the lower esophageal sphincter is lax, it doesn't close properly, patients do develop complaints of heartburn or gastroesophageal reflux disease, which can be seen on upper GI endoscopy and in various other investigations. Because gastroesophageal reflux is an important disease, we need to know how it is prevented. So we've talked about how aspiration is prevented, which is very important. And we also need to know, simply because of the wide ranging prevalence of this disease, how gastroesophageal reflux is prevented. First important role is played by the gastroesophageal sphincter's tone. Negative intrathoracic pressure also very important, and the pinch cock effect of diaphragm also plays an important role. There are mucosal folds and the angle of the esophagus and the stomach is not in a straight line. That angulation also helps in preventing food from going back up. And there is slightly positive intra-abdominal pressure. So negative intrathoracic pressure, positive intra-abdominal pressure, angle between the esophagus and the stomach, mucosal folds, pinch cock effect of diaphragm, and tone of the gastroesophageal sphincter. These are the factors which prevent gastroesophageal reflux. That was my brief description of the physiology of deglutition. I hope you liked it. If you have any questions, do let me know in the comment section. I always reply. Thank you for watching. Take care. Bye bye. And as always, please don't forget to be awesome.